My name is Bulent Cetindag. I am a general and a trauma surgeon with BCH. I came here from Iowa. They called me hernia doc. That's my specialty. I also take care of all types of abdominal emergencies or elective surgeries. I also did a fellowship in surgical critical care, and the first part of my career was very much involved with trauma. Outside of work, I'd like to be outside like rest of the community here, but also I'd love to read nonfiction books. My philosophy for the patients is to treat them like my family. Follow like they are my relatives, and whatever I would do to my brother or to myself, I would say the same thing, and I say it as is. Surgery is the last resort for everything. In places that I worked for for-profit hospitals, non-profit hospitals, and I think BCH culture fits to me because they are very much patient-oriented, and we don't sell surgery here. We just do surgery when it's necessary. And honestly, in elective situations, if it's not an emergency, it is really a patient-centered decision how to do surgery, when to do surgery, whether surgery is necessary at all should be a part of the discussion of the patient visit. So that's why I say we are not selling surgery. We are doing surgery around patient needs. The team I work with, I met all of them here, and I couldn't be more happier and click with the people that I work with. Each of us has our niches, and each of us are very helpful to each other. I really feel like this is one of the most collegial environment that I worked as a surgeon.